Good morning, my name is Jinky Young, and for today, I'm going to perform administering oral medication. I'm going to start with checking the physician's order because the chart of the patient is more reliable than the medication ticket. Then next, I'm going to check for the medication administration record for the drug name, dosage, frequency, and route because sometimes order for certain medication expire after a specific time frame and they need to be reordered by the primary care provider. So I can see here an order of cetirizine 10 ml twice daily after breakfast and lunch. I'm going to administer it orally and I'm going to give it this morning at 10 a.m. And I can also see an order for trimethoprim, which is also given twice a day after breakfast and lunch, 10 milligram. And I'm also going to administer that to the patient orally this morning at 10 a.m. Then I'm going to verify the client's ability to take the medication orally. So I'm going to determine whether the client can swallow, is nauseated, vomiting, has gastric suction, or has diminished or absent bowel sounds. So the patient can swallow, is not nauseated, and also not vomiting, and the patient does not have any gastric suction. Then I'm going to organize the supply to save time and energy and also reduces the chance of getting error. So I have here my medicine cup and also a medicine dropper as well as gloves. Then I'm going to bring the requisites to the preparation area because organization facilitates error-free administration and also saves time. Then next I am going to read the MAR, take the medication appropriately in the box, read the label, and remove the medication in the box. This is to appropriately and ensure correctness of medication is taken. So I have here cetirizine and trimethoprim. Then after that, I am going to compare the label of the medication against the order in the MAR or the computer printout. This is a safety check to ensure that a correct medication is taken and prepared. Then I'm going to recheck the label of the medicine with the MAR and also note the expiration date because outdated medications are not safe to administer. So the expiration date is November 2022 as well as this one is October 2023. The next, I am going to prepare the prescribed medication. So for tablets or capsules, I am going to gently shake the medication prescribed in a bottle cap. This ensures that the correct drug is prepared. Then if in a box, I am going to gently shake the prescribed medicine in a medicine box. This is to mix the drug well and to make sure that the accurate medication is prepared. So for liquids or suspension, I am going to thoroughly mix the medication because we need to mix it before pouring, and some medication requires to be shaken well. So I'm going to discard any medication that has changed in color or turned out to be cloudy. Then after that, I am going to remove the cup and place it upside down in the countertop. This avoids contaminating the insides of the cup. Then I'm going to hold the bottle cap so that the label is near my palms. Then I'm going to pour the medication away from the label. This avoids the label becoming soiled and illegible as a result of spilled liquids. Then after, I'm going to place the bottle cap on a flat surface at eye level. This method ensures accuracy of measurement. Then I'm going to place my thumb on the prescribed level. Then I'm going to read it at lower meniscus because this is to get an accurate measurement. Then I am going to pour out the exact amount of medicine prescribed into the medicine cup to appropriately measure the medicine. going to wipe the brim of the bottle using a paper towel or a tissue paper before capping. This prevents the bottle cap from sticky drops. Then I'm going to use a medicine dropper and draw the amount needed to appropriately dispense liquid. So I'm going to get an exact 10 ml. Then after that, I am going to place the medicine-filled dropper into the medicine cup. So this avoids soiling and contaminating the medicine dropper. Then I'm going to place the prepared medication and the MAR on the counter on the medication cart. So we need to prepare all the necessary equipments to reduce the chance of getting errors. Then I am going to read the room number in the MAR before entering the client's room. This is to make sure or ensure that I'm going to enter in the right client's room. Okay, so the room number is 209. Then I'm going to bring the requisites to the client's room. So I'm going to provide privacy by ensuring the client's integrity, dignity, and respecting their privacy by closing the door or curtain. So I'm just going to close the curtains. Then after that, I'm going to introduce myself. This is to establish rapport between me and my client. So good morning, sir. My name is Jinky Young, and I am your student nurse for today. I'm going to administer your medication for this morning, okay?
Okay.
Then after that, I am going to verify the client's identity by asking to state his or her name, or I'm going to check the client's wristband. This prevents errors in medication and also to make sure that I'm going to take the medication onto the right client. So can you state your name?
Derek.
Okay. Then I'm going to ask the client for any allergy. This is to ensure that no client has given a medication that contains ingredients that the client is allergic with. So do you have any allergy on medicines?
No.
Okay. Then next, if the medication is highly acidic, I am going to take it with some snacks such as crackers if food is not contraindicated, because highly acidic medicine can irritate our stomach, and taking it with some food or snacks can thus reduce this effect. Then after, I am going to match up the MAR at each client's bedside with the medicine's names and also the name of the client to assure correctness of medication. If needed, I am going to perform pre-administration assessment, such as taking the blood pressure, pulse rate, and respiratory rate of the client. And if any of these findings are above or below the parameters, I am going to consult the primary care provider before administering the medicine. So the client's blood pressure is 110 over 115. The pulse rate is 17 cycles per minute, and the heart rate is 75 beats per minute. Then after that, I am going to discuss each purpose of the medication as well as its relevant information, such as its side effect, possible side effect, and also its action. So this enhances client's cooperation and reduces apprehension. So sir, I am going to give you cetirizine and also a thermoproplin. So cetirizine will help to ease your skin allergies. So the possible side effect is you can feel a bit drowsy or sleepy after taking in the medication. As for thymothropin, I'm going to give this for your urinary tract infection to lessen the bacteria, and the possible side effect is that you can feel a little bit of headache before administering the medication or taking in the medication, okay?
Okay.
Is that alright?
Yes.
Okay. Then after that, I am going to assist the client for a sitting position or a side-lying position, because this position is swallowing and also prevents aspiration. So I'm just going to assist you for a sitting position. Okay. Okay, so now I'm going to give the medicine to my client to make sure that I'm going to give the medicine to the client with the guidelines agency. So I'm also going to give it with some crackers. So can you please open your mouth and take it with some crackers. So I'm going to make sure that I'm going to stay with the client until all the medication has been swallowed, because it is very important for the nurse to stay with the client until the medication has been swallowed before the documentation of the drug administration. Okay, so are you good?
Yes.
Okay, I'm going to assist you in a supine position. That if everything has been settled, I'm going to document the following. So I'm going to first document for the drug name, dosage, frequency, and route to prevent errors in medication. So I've given cetirizine and thrombophlebitis to the client once this morning at 10 a.m. orally. Then I'm also going to document if the client has any complaints or assessments. The best is to evaluate the patient for intended or adverse effects. So far, there is no complaints. Then I'm also going to document if the medication has been refused or omitted and the reason for omission. This is the nurse's responsibility for this kinds of action. So the medication has been not refused. Then I'm going to put my signature, because it's very important to reduce the possibility of repeating the drug administration to reduce the risk of medication errors. So documentation is done. Now I'm going to replenish stocks and place the medication cart on the appropriate place. So I'm also going to discard any supplies that is disposable. Then I'm going to perform aftercare of equipment. So I'm going to wash, rinse, and dry all the equipments used. Then I'm going to put them on the appropriate places. This prevents contamination and prevents microorganisms spread from one person to another, since another person may use these equipments. So after that, the drug administration of oral medication has been completed. So that's all for my written demonstration.